So my name is Rumbi. I am a F1, and thank you guys so much for having me. I honestly thoroughly enjoy this type of stuff. This is my favorite type of thing to do because when I was applying, I went to talks like these, and I think it was really helpful for me. So for me to be on the other side, to be able to speak at something like this, absolutely amazing. So thank you so much for inviting me. So yes, so my name is Rumbi. I am an F1 class of COVID-19, graduated medicine this year. But prior to that, studied midwifery, and so did medicine as a graduate. Plot twist, did not do a graduate entry course. I did a normal 5-year degree, but as a graduate. So I'll quickly take you guys through a little background of my story, how basically from 18 to now, the ups, the downs, the highs, the lows, and we'll take it from there. I'm just gonna turn my stopwatch on because I think the questions are the most important bit. So I'm starting my timer so that I don't talk too long for this bit.
Correct.
So when I was 18, did my A-levels as everyone else did and applied to medicine. I had 4 medicine choices and my 5th choice was midwifery. Now, interesting that Aaron has already mentioned that you guys are more of the biomedic side, biomedical science being the most common alternative option to medicine. Now, when I was applying, why did I not put biomed? I think as a person, I sat down, spoke about the things that I enjoyed the most as a person. I think I was more of a vocational person. So I thought, right, medicine works for me because XYZ, practical skills, blah, blah, blah. I'm really good at biology. I'm really into chemistry and that type of thing. So it will be really well suited in that respect. But as a second option, what would be the next best thing for me as a person? So the things that I looked at really were midwifery, of course, which I ended up going with. I looked at nursing a little bit. I looked at physiotherapy. I looked at radiotherapy. And did I look at OT? I don't think I did. But basically, it was the degrees that were free on the NHS because that was important for me. And we'll talk a little bit about finances a bit later on. But yeah, I looked at degrees that were free on the NHS at the time, and midwifery was free, radiography was free, nursing was free, plus a bursary. I looked at degrees that if I then didn't get into medicine again, what would I be happy with doing as a person in life? And I thought, right, okay, so if I apply for medicine, don't get in, and I do biomedical sciences or biological sciences degree or biochemical sciences, I don't know the variation, and then I don't get into medicine again, what will I do? And that fear of then having a degree that I didn't particularly want and didn't know what to do with is what drove me towards the practical things. So it's what drove me towards putting like midwifery as my second choice and the ones that I listed as my options for second choices. So that's where I was. Sent my UCAS form. I had one interview at Bristol, which was terrible. It was horrible. It was one of those interviews where you come out and you're like, well, that went poorly. And I remember being on the phone to my mum after, being like, Mum, I don't think it went well. And she's like, no, it's going to be fine. But it didn't go well. And that was a mixture of things. I think poor preparation didn't help. But there were a lot of other things going on in my life at the time. That was that. So I didn't get any other interviews for medicine at 18 when I applied. And I went for my interview for midwifery. And interesting, I was waitlisted. So midwifery is a really competitive course. Their numbers are capped by the NHS. So for example, the course I ended up on had only 45 people in the class. So I was waitlisted for midwifery because they were like, you don't even want to be a midwife, like we're your 5th option. There's so many girls that have been, or so many people that have been wanting to study midwifery. Look at all their applications that are geared towards midwifery, and you are applying as a second choice, So understandably I was waitlisted, And so when I heard back from all the medicine places and I was still waitlisted for midwifery, I called them and I was like, right, guys, it's crunch time now. Either you tell me whether you want me or you tell me whether you don't want me so that I can go look at other options. And then the university that had waitlisted me replied and were like, we're still deliberating. If either you say no to the place or you agree to continue to be waitlisted. So I was like, right, okay. So then I said no to that place. And I think my year was one of the first few years that there was UCAS Extra. So if you have no offers at all, then you have option to look at UCAS Extra. So then I went on UCAS Extra and found an amazing midwifery course. And because I was applying with it was like as part of UCAS Extra, so I don't think they had access to my previous personal statement and stuff. I got to send them a specific midwifery personal statement. It was all great. It was fantastic. I got in and I was studying midwifery. So then I stopped this midwifery course. Now, the back of my head, medicine is the plan, right? I always knew that I would reapply irrespective of what degree I did, whether or not I didn't end up getting any offers for any university places. I was always going to reapply for medicine. So I studied my midwifery course, and I did midwifery in London, which was really, really interesting because the hospital that I trained at had medical students, so I got to chat to them and just kind of hear about their experiences. And also, London just was one of those places where there were all these free lectures going on. You just kind of Google and various things pop up. So like random talks on the history of the humans and just various stuff that I got to go to for free and kind of broaden my knowledge, broaden myself, and it all helped when it was time to apply again. Because like you don't really realize at the time, it all feels really far away, but like first year of uni flies by, second year goes, and next thing you know, you're applying for medicine again. So that's kind of where I found myself. And so it was time to apply again. I was in the beginning of my third year of midwifery, applied for medicine, and this time, I mean, my experience in the hospital as a student midwife, boom, stuff to write about. I also worked as a HCA, stuff to write about on the personal statement. All these lectures that I was saying that I was able to go to for free, again, something to write about because, you know, interest in medicine, trying to go above and beyond to look into this type of stuff. I was able to, like, my uni was very social. I played sport. That was all stuff to write about in the personal statement. The biggest thing for me was the entrance test. So, okay, personal statement wise, I had, just from the basis of the course that I did, the work that I did as a HCA, and the other things that I did, I had a reasonable amount to write about. Entrance exams were like the next bit, because I was thinking, right, okay, which universities do I apply to now for medicine? And I didn't end up applying to any graduate entry courses. I could have, but I didn't sit the GAMSAT. And that was a personal choice for me. I found that midwifery as a course was really, really, really quite full on. I've made it sound fun and happy and enjoyable, but it was full on. You're on placement 37 hours a week. That doesn't include your time to then study and write a dissertation and blah, 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 blah. So I thought about it and I thought, okay, studying for a GAMSAT is going to be more labor intensive for me than what I can offer, you know, just looking at the time that I had. And I was also working, like I mentioned. So UK CAT was really the option for me. And I thought, okay, it's better if I just focus all my energies on one entrance test and apply to unis that look at that particular entrance test and take it from there. So because I only did the UK CAT, that kind of narrowed down my options a little bit for what unis I could apply to. And then I actually want to say, were there any, there must have been some graduate entry programs at looked at the UK CAT. I'm not sure. I'm sure they were. I can't even remember off the top of my head. Aaron, do you know of any?
So I think the UK CAT has been a recent addition to graduate entry courses. It was, especially for yourself, when you said you studied midwifery, it might have been the only exception for you to study the GAMSAT because of the specific courses that they only accept with the UCAT now onto graduate entry. It has to be very scientific based. They only accept, say, like biological sciences, biomedical sciences, and I think biology with a UK CAT. Some universities, any others are excluded, just mainly because of the content that's covered within the course.
Okay.
But
So that's good knowledge. And that's important because, like, I'm speaking from experience of 6 years ago now, 2014, 15, 16, 17, 18, 19, 20, yeah. So I was applying around about 2014. So all the stuff I'm telling you, 6 years in the past. So I did the UK CAT and it went okay. It wasn't fantastical, it wasn't terrible, it was okay. So I applied to normal standard entry 5-year courses. And the reason why I did that at the time, I looked at kind of the entry requirements. Some universities don't let graduates apply onto their standard 5-year courses. Some do. So I looked at various unis, looked at the entry requirements, and looked at ones where I was most likely to get an interview, really. And those were the 5-year courses, it looked like, were the ones where I was just most likely to get an interview, because I felt, for me, once I was at the interview, I could really show myself, really, give it my all. Whereas on paper, maybe I didn't look as fantastic as other candidates. So did that, went on interviews, and it was all MMIs, which was great because I think, so having studied midwifery, all our exams were OSCE style. So I was already into the habit of that whole, hello, my name is, getting into a station, giving it into that station, and then turning off the minute you go into the next one, and then going, just doing the stuff you need to do for the next one. So I was already kind of trained on the MMI format via doing OSCEs for midwifery. So I actually did well in the interviews. And so got my offer, here we are, medical student. The transition, I always say this because it's hilarious. So I finished studying midwifery on the 10th of September. And then I started studying medicine on the 21st of September. So like my midwifery course finished on the 10th. My medicine course started on the 21st. So it was really, really, really like, pack your bags, get everything, go, But I think it was quite nice. I do miss having that like last final summer, which I never got. And so I studied medicine. I studied medicine in Belfast, which is in the UK, but in Northern Ireland. And one of my friends who also studied in Belfast was like, when she got her interview offer, she was looking at trains to get to Belfast. She's like, why are there no trains that go here? Because it's like an aeroplane away. And that was a huge thing to think about and consider. But the pros for me were, which we will get into, where it was just a much more cost-effective place to live. So with medicine as a graduate, unfortunately, student finance don't fund it. Now, the earlier reasons, as I was mentioning to you guys, is like my second options were all courses that were funded by the NHS. At the time, I thought that would be perfect because if student finance don't pay for one of my degrees, they will still pay for medicine. So there was all this thought that went into it. Now, imagine when I'm now filling in all my stuff for medicine and student finance is like, no, sweetie, even though we didn't pay for your first degree, just because you have a degree and you're doing another undergraduate course, we ain't gonna fund that. So you're gonna have to find the coins elsewhere by yourself. That was challenging. So yeah, bear that in mind. Finances are really, really important to think about. I think tuition fees now is $9,250 a year. So that's just for the pleasure of studying medicine. Let's not talk about the cost of your books, of any other like associated costs. You might want to get a stethoscope, you might want, you know, those types of things, accommodation, food, transport to get to where you need to get to. All these things are really, really important to think about. And so for me, once I realized that student finance wasn't going to help a girl out, I applied for jobs. So I applied for midwifery jobs in Belfast. And on my application forms, I let them know, yo, I'm studying medicine, so I can only work X amount of hours, X amount of time. And I don't know, I think things always work out for a reason. This worked out for me because I got a job so easily as a midwife. And it's not even like I was locum to begin with. I worked on rota. My employers were so accommodating. Like, midwives are in such, you know, there's not, like I said earlier, the numbers of midwives are controlled by the government. So like a cohort will have 45 people. So there is just a shortage of them. So whatever you could offer a hospital, they're always like, oh my God, yes, we'll take it. When do you want to work? What hours do you want to work? That's the experience I had. So my midwifery degree basically allowed me to have a job which paid for my medicine degree, in a nutshell. So that worked out really, really, really well for me. So yeah, I think that describes my story. From there to now, studied medicine, graduated, here we are as an F1. I'll check how long I've spoken for. 15 minutes. Okay, good. What would I want to impart on you guys in terms of the real key things, aside from all the stuff that, you know, finances, important to think about. Think about not just the cost of the degree, but also cost of living in the various places. If you're applying for, or if you're thinking about which unis you're going to put on your application, I would highly, highly, highly recommend not just look at geographical location. I know, you know, sometimes you don't want to move to Belfast, you don't want to move to Scotland, or you don't want to go to Kiel or things like that. But think about cost of living also, because as a graduate, I think that can impact, but also your chances of getting an interview. And that's always the first hurdle, because once they see you in person, I think you can always bring your best self. But yeah, apply to places where you're maximizing your chances of getting an interview. And in terms of the entrance exams, it is what it is, you know. So what would I say about that? Just give it your all. Find what works best for you and study in that way. And you guys are lucky in that you've already done a degree, so you kind of have an understanding of your study style, and you guys have a network. I mean, there's a few of you, there's a society of you that are all aiming for the same thing. So kind of support each other, help each other, and kind of carry each other through all of that. So yeah, that's what I would say.
Yeah, perfect. I completely agree. So I guess the logical starting point would be to just talk about your first application to medicine. So with you reflecting on your first application, is there anything you believe now that you could have improved on, or is there anything you think you did well throughout?
I would say I was just, and I think this is an ongoing issue, especially for people that go to state schools. I don't think there were resources from my school that would enable me to optimize my application. Like, I was someone that got A star and 2 A's at A level. But there was that support to be like, okay, you want to apply for medicine, this is what you need to put in your application, this is the extracurriculars you need to do. And so it was all kind of really ad hoc with what my family can support me with, and the personal statement, yes, maybe it was read once by a tutor or a teacher, but when I compared that experience to the experience of my friends who went to maybe grammar schools, for example, the resources geared behind them and their applications are just so phenomenal. Work experience is being arranged. For me to get work experience, it was like up, down. I didn't know any doctors. I didn't know anyone that worked in the hospital. And so I did get work experience in the end, but it was like a week here or there. And like the volunteering was all, again, you really had to be self-motivated. And I think I was that, but it really would have helped, as I was 16, 17 at the time, to have a more structural push to help optimize the application. I think that was one of the issues, is the stuff was there, but it just wasn't, it could have been better. Like the work experience was there, but yeah, okay, you did volunteering, yeah, okay, everyone else does that. Oh, you read a couple of books, cool, nice. But what would have made me stand out? And I think there was stuff about me that would have made me stand out, but I had no idea, and my family had no idea how to put that into a personal statement to then make it shine, I think.
Yeah, I completely agree with your answer. In that state schools don't have the resources to fund and support these very niche job opportunities that are really highly competitive. I mean, just to move on from that, with your first application to medicine, what admissions exams did you sit? And now looking back, how did you find them first time around?
UK CAT, and it was, again, I think I studied like with the book. I also feel like I had like a couple of friends that were applying to medicine. Like I knew one or two people. I didn't know a lot of people that were applying to medicine. So having other people around me would have been fantastic. So we could have all motivated each other to study, and there's that little bit of like competitiveness with each other, because you're like, oh, okay, they're studying, okay, I'm gonna study. But yeah, no, I did the UK CAT only. I didn't do any other entrance exams. Again, I think I was scared. I was scared to write the BMAT, because you don't know your results until after you send the application. And there was a certain amount of like, oh, this is risky. Do I want to do this? And then two of my choices have gone towards, unis that look at this test, but I don't know how I've done in the test until the application is sent. So I think that's what influenced my choice as well.
Yeah, completely agree. So the second time you sat the UK CAT, it would have been at the time. Is there anything you did differently to approach the exam, or is there anything you found that helped you with revising for the second time?
I think I missed out a crucial detail also, which low-key would recommend if you have a spare. If the test still costs 80 something pounds, and if you're thinking about doing the UK CAT, I would recommend this. So I sat the UK CAT after my first year of midwifery, just to be like, because I think the first time I sat it, I had a lot of test anxiety. All these tests that you can only do once and once only. There's no retake. What you get is what you get. I think it just induces a lot of anxiety. So I sat it at the end of my first year in midwifery, which was just like I'm just gonna waste £83, go sit this test, and just be in the environment, experience it, do it. And so when I sat it for real, which was at the end of my second year of midwifery, I don't know, I think the anxiety was a lot less, because by that time I'd done the test 2 times prior. Just timed practice, so important. And I think doing the test in the middle bit, it kept my brain into kind of the whole UK CAT thing, but it also highlighted the things that I was having issues with. So the time was just, you blink and the time was gone. So I had to just, work on doing things under timed conditions.
Yeah. So within your second application to medicine, is there anything you believe you did differently, or anything you did more of to secure a place the second time around compared to your first time?
I mean, my application was just better. So if you think about like all the pillars that you would be looking at if you want to demonstrate the things that maybe universities look at you demonstrating. So I listed desirable qualities. So time management, I didn't list them on my application, but I mean, like, I listed these types of qualities and I was like, what can I do? What have I done to demonstrate that I can manage my time, that I can show leadership, that I can show interest in the profession, all these types of things. And because I think, and which is the position you guys are in as well, you already know you want to apply to medicine. So start thinking about these things and do stuff which you can gear towards. So for example, time management wise, I was the captain of my uni tennis team. I worked as a HCA whilst also studying midwifery. Boom. I mean, that's all of those things are quite challenging in time and demonstrates time management. Leadership, the whole captain of the tennis team thing fitted well into that also. Team skills or working as a team, you start to think about when opportunities arise, and you guys will find various opportunities will arise, how can that particular opportunity fit into a desirable characteristic for an application? So I think the second time around, I was just much more methodical. I don't think I even added a single bit about, I read a book about medicine and it was very interesting. There was none of that. Each word in the personal statement was trying to show all these qualities and aimed towards demonstrating an interest in medicine. And also, my personal statement, I would say, was read maybe 6 or 7 times by 6 or 7 different people. So medical students that I had befriended, my tutor at uni, consultants that, as a student midwife, you work within the hospital, so you work with doctors all of the time. So I mentioned I want to apply for medicine. Is there anything you can help me with? Any advice you have? And they offered to read my personal statement, and all honestly, like, just made such a difference. And the sad thing is, these are things that not everyone has access to. That's the worst bit.
Yeah, I guess a good follow-up question would be, is there any specific tips or warnings you would give to somebody that's just starting out in medical school? You mentioned when applying you need to meet the basic criteria of what a good doctor is, essentially. But yeah, again, would there be any tips or warnings you would give somebody just starting out medical school?
As in applying, or
so once they've successfully achieved their application and just starting out,
live your life. Once you've got in, live your life, enjoy yourself. First year and second year, really enjoy, because once you actually start working as a doctor, the first couple of years of working, where is the enjoyment? So medical schools invest so much in you once you're in, that you have to do something terrible to be kicked out. Not that I'm encouraging laziness, but just those first couple of years, study, pass your exams, but also enjoy that uni life again. Enjoy freshers, refreshers, like, keep in touch with all the things you enjoy, because as you go further up, as you go into placement years, can get quite demanding, and the exams do get more demanding the further up you go. So finals, for example, I've never spoken to anyone who said they enjoyed the 4 months leading up to finals. It's just tough. So enjoy your life whilst you can. Definitely, first and second year, please. Relax, enjoy.
Yeah, I guess you're one of the unique few that has done a undergraduate degree and then gone to study a non-graduate entry medical degree. How?
My uni cohort, 30% of us were graduates.
That's exactly. So we had Kenji Tamita on, and his exact. I think it was the exact same stat. It was like 30 to 40% of his course were graduates, and that was really surprising to me. So how did you find, like, obviously you said you was very active within societies and sports within your first degree. How did you find that? Obviously you had to fund your medical degree. How did you find still in that time for extracurriculars?
Oh, I had no time for extracurriculars, which is why I'm encouraging you guys to have fun and enjoy. I was literally working 25 hours a week for 3, I would say, years, and then a little bit less for 4th year, and then really down to minimal for 5th year. So final year was luckily NHS funded, so it kind of took the pressure off. But yeah, no. I was working. I had time sometimes to go enjoy, make friends, blah blah blah, but it was not the same level of freedom that I had in my midwifery degree.
Yeah, I guess this is what I'm trying to get across with this guest lecture series, is that even if you don't get into a graduate entry medicine degree, you can still fund yourself, if that be working part-time. As like Kenji said, he worked in a restaurant for his first 3 years as a doctor.
Mm-hmm.
So how would you say the course differs? Obviously a midwifery course is very condensed because it's only 3 years. How did you find the transition from midwifery to medicine?
A lot of people ask me this, and I always say midwifery as a degree was 4 times harder than studying medicine, hands down. Medicine, the information you need to know is book knowledge for the most part, and then OSCE stuff, and you practice your OSCE skills. If you go into hospital placement enough times, you've been exposed to enough things to pretty much be able to navigate most OSCE scenarios. Now, obviously, some of us would come out of exams like, when was this ever taught? But midwifery, as a course, as a degree, is a vocational course, which is also a BSc. So you're on placement. So I always give this example in that I started in September, placement started in January. My first placement was like 4 night shifts. What? And you can't just leave and be like, oh, gee, thanks. I want to go home now. No, you stay the whole night. You have X amount of deliveries you need to get. You have X amount of postnatal women you need to look after. Like there is a logbook. And the thing is, these are legal requirements. You must get these numbers, otherwise you cannot qualify as a midwife. You must work these hours, otherwise you cannot qualify as a midwife. And that's before you've even talked about studying, because there's still exams, there's still writtens that I must pass, there's still knowledge I need to know. So yeah, it was just a tougher course.
I guess progressing into where you're currently at now, what does a typical day look like for a newly F1 doctor?
It's really, I was reflecting on this the other day, because all the things that you demonstrate when you apply to medicine don't really use when you're studying medicine, because as a medical student we have so much flexibility. You come to placement, and if there is nothing more for you to do, you genuinely leave like there's nothing for you to do. So you go study, or you go do other things. You're much more autonomous with your time, autonomous with your study, and you can prioritize, how you want to. So we don't get to really demonstrate all the things in med school that you kind of demonstrated when you were applying. So all the leadership, all the like team working, things like that, time management. Now you start F1, and so I work in the busiest surgical emergency unit in Europe. And if I tell you, like, time management is a big thing in my job. People management is 90% of my job. Just not just people skills per se, but managing expectations, prioritizing tasks, all the things, leadership, because so the nursing staff really look to you, because on the ward that I am, it's like F1s and the consultant. There's no in between doctors. So you are the doctor that's on the ward. So the nursing staff really look to you for a lot of stuff, and And so that leadership element really does come into it quite a lot. Like I said, time management is a big thing. Like, I do the job of like 3 people most days. It's I even laugh because it's funny. But as you progress, so I'm coming towards the end of my first job, I've just got so much better. You get efficient at doing tasks. Yeah, basically, yeah. All the things you guys are going to be demonstrating now, you're going to be using in 5 years' time.
Yeah, excellent. I guess just finally for the future medical students watching this video, what would be the one golden piece of advice you'd give them into their application and securing a shot at becoming a doctor?
Ooh, that's tough. That's really tough. Only one piece of advice.
I mean, it can be more than one.
Okay, so in terms of application wise, really, if I tell you, like, really research the unis in such detail so that you apply to unis where you're maximizing your chances of getting in. So various unis, some release their like scoring systems, their cutoff for scores or what point systems they use, and you really have to go digging for that type of information on the internet, but it is there. So yeah, that would be the first thing in terms of trying to secure an interview. Once you have an interview, practice. Oh my God. Practice. If it's an MMI, you and your mirror, practice like recording yourself and seeing how you respond to questions, mannerisms that you might not even notice that you have. You probably have, you know. Practice with friends. It can be so hard to open up, to be vulnerable, to let your friends ask you interview questions, and then, you know, what if they laugh at my responses, things like that. Don't worry about it. Practice with family if you can, and if the option is there, practice with a professional, you know, someone who's in a particular job or whatever where they are used to conducting interviews. And so that's to get past the interview stage. And then once you're in, please enjoy. Please just relax and enjoy and pass exams. That's it.
Thank you. It's fantastic. I'd just like to open up the chat for questions. So just give it a minute for people to grab the keyboards. So Manny's got a question. Did you find it a culture shock at all moving to Northern Ireland?
A little bit. There were people where our placements are all across Northern Ireland, not just in Belfast. So I would go to places and I'm the first Black person someone's ever seen in real life. Like, that happened to me more than once. So yeah, it was a culture shock, but it was fine.
Wow. Mm-hmm.
It just was one of those things.
Yeah, I guess when you relocate across Northern Ireland, were you based in one particular place, or it was just the whole of Northern Ireland where you had to relocate?
So your placements you can be allocated to any hospital in Northern Ireland, and you can be allocated to any hospital for any specialty, if that makes sense. So as an example, you could do your general medicine placement in one hospital, and then your general surgery placement in a hospital 2 hours away, and then your obs and gynae placement in a different hospital, and your ENT placement in a different hospital. So just because you were given a particular hospital, that's not to say you're going to be there for the whole year. We were always switching around. You're never really more than 2 hours away from a particular place in Northern Ireland, so it wasn't the end of the world. But for the further placements, they provide hospital accommodation, so you will have somewhere to stay. It's just not always the nicest.
Yeah. So Manny's got another question of, do you know what kind of doctor you'd like to become, and are you sat on Northern Ireland now, or would you like to travel elsewhere?
I don't work in Northern Ireland. I work in England. And I would like to be an obstetrician.
Yeah.
I wanted to be a GP for like the longest, but now
Yeah.
I want to be an obstetrician.
Yeah, and then we've got a Keith with a question of, do you have any tips of organising any work experience during COVID?
Yes, email. So someone messaged me on Instagram recently about organizing an elective placement because they all have to do their electives in the UK with the whole COVID situation. And I said, so part of my elective last year, I did at an A&E department in Guernsey, which is like the most randomest place. But I swear to you, I just emailed random people whose email addresses I found on Google, and surprisingly, a large number just got back to me and were like, yeah, I don't organize that, but I'll put you in touch with the person that does. So just send a bunch of emails. Which hospital do you want to go to for your work experience, and what department? So that type of stuff would help. So if you email various emergency departments asking, I am so and so, I'm applying for medicine, would really be interested in work experience, what options can you offer? Yeah. I think it's really worthwhile. We've had a few work experience people with us, so it's happening.
Yeah, perfect. So we've got a question of, I think I read it right. Having a job with medical school, how did you find managing your studies with work, and did it become too much at any one time, or?
It was really challenging. It was quite tough. I will definitely say that. I don't think, in hindsight, it probably was too much at certain elements. But when I was in it, it never felt like that. I was always go, go, go. And me as a person, when I'm busiest, that's when I'm the most efficient. So because I knew like I only have X amount of time to study, I studied. So because the time I had was finite, I was more efficient with it. But yeah, in hindsight, it probably was a little bit too much at certain times. But the other side of it is I do get to leave uni, unlike a lot of people, with a free NHS degree and a degree that's been paid for, So there is pros and there's cons.
Yeah, I guess you had the perfect storm of being able to work in a hospital and get paid whilst you were so you were around that setting constantly, if that be whilst you're working as a midwife or you were studying for your degree.
Exactly.
Obviously, other people won't be able to have that luxury, if you'd like to call it that, but I guess that would have benefited you, not with your studies, but also with you learning and progressing within both careers.
Oh my gosh. And the thing is, like, whenever consultants or people would find out that I'm studying medicine, or even other midwives, specifically the doctors, other midwives, it was fine because I was just doing my job. But when the consultants would find out I was studying medicine, it was like, oh my gosh, and have you thought about this? Or do you want to be part of this research or that audit? And just opportunities arose. So what I would say for you guys is, if you can, work as a HCA. Like, honestly, it's phenomenal. The pay, I think, is actually quite good. It's fairly flexible if you're working bank, and you get invaluable experience. Just being in the hospital setting, being around patients, seeing how the system works makes such a difference. So I think if that's an option for you, then look into working as a HCA.
Yeah, perfect. So just got a follow-up question from your previous answer of, when sending emails for work experience, should you attach a CV and a cover letter, or should you wait until you get...
Wait and find out what they want from you.
Perfect. And just a final question of, have you ever thought about doing research, or have you ever done research on the side?
Yeah, so if I could give you advice for going, once you're in, to actually get a job as an F1, you enter this big national ranking system. So every single final year medical student in the UK is ranked from 1 to 7,000 and something. So it's based on two things: an SJT, which is an exam, and then your overall education score. So your scores at uni against your colleagues. But there's very few things that you can do to give you those extra little points, and that's like research. So if you ever end up with a published paper, that's another couple of points that could just head you towards getting to the deanery you want to work in or getting the job you want to work in. So I would always recommend that if you're studying and an opportunity comes, then yes. And the answer to your question is yes. I think research is just integral in medicine. Can't advance without research. So even if we look at the COVID vaccine at the moment, research has to have gone in to trialing that, to, you know, seeing effects and side effects before it can become a thing in clinical practice. So clinical practice can't change without research. So yeah, yes, I am involved in research. Yes, I have been in the past.
Yeah, completely agree. I mean, if nobody's got any other questions, let's give it a couple more seconds. Yeah, so finally, again, on behalf of everyone, I'd just like to say a massive thank you for taking time out of your evening to take part in this discussion.
Thank you for having me.
So for people that want to follow you and learn more about your story to medicine, how can they do that?
You can find me on Instagram at Rumbi the Medic. And I always say this, I've read so many personal statements. I'm more than happy to read a personal statement, to give you advice on like what to put in your personal, well, not necessarily what to put, to like advise you on it. I did a lot of that this cycle that's just gone. So if you guys ever need that, hit me up.
Perfect. Thank you for your time, Rumbi.
No worries. Thank you.
Thank you. Have a good night.
Bye.
Take care.